Good afternoon, and welcome to the City Club of Cleveland. My name is Jan Roller, and I am president of the club. We welcome you here, as we do every Friday, to learn and discuss important issues of the day. Today, we will hear from Jeffrey Crowley, Director of the Office of National AIDS Policy. As Congress continues to debate an overhaul of our healthcare system, the AIDS epidemic continues to loom across our nation. It's a sobering topic. Roughly 1 million people live with AIDS in the United States. Since the start of the epidemic, 1.5 million Americans have been infected and 524,000 have died. At least 40,000 people are infected each year. Almost half HIV infections are African American, the new infections. And the number of women living with HIV has tripled in the last 2 decades. It's also alarming to know that at least half of all new infections are among people under the age of 25. These figures, of course, are dwarfed by the global AIDS crisis, with its statistics that over 33 million people now live with HIV or AIDS in the world. 5,700 people die every day from AIDS, and 1 child every minute. The Obama administration has tough challenges to tackle with these statistics. When the President named Mr. Crowley Director of the Office of National AIDS Policy in February, he said, "Jeffrey Crowley brings the experience and expertise that will help our nation address the ongoing HIV/AIDS crisis and help my administration develop policies that will serve Americans with disabilities." Since becoming director, the administration made what has been called a monumental policy change by lifting the 22-year ban on entry to the country for people infected with HIV/AIDS. The United States had been one of only a dozen countries that still barred entry of people with HIV. Mr. Crowley is well qualified for his position. He has a master's in public health from Johns Hopkins and served for 2 years in the Peace Corps in Swaziland. Since 2000, he has been a senior research scholar at Georgetown University's Health Policy Institute and a senior scholar at the O'Neill Institute for National and Global Health Law at the Georgetown University Law Center. In these roles, he was recognized and respected for his capacity to integrate public health research with political strategy to achieve policy changes. His primary expertise is Medicaid and Medicare policy and prescription drug policies. He also has spent the last 14 years working to improve access to health and social services for people living with HIV/AIDS, people with physical disabilities and mental disabilities, low-income individuals, and other vulnerable populations. He was Deputy Executive Director for Programs at the National Association for People with AIDS, and while there, helped implement several key initiatives, including the National HIV Testing Day and the Ryan White National Youth Conference. He has authored numerous reports and policy briefs and testified before various congressional committees. So we're very glad he has taken the time to be with us today. And ladies and gentlemen, please welcome Jeffrey Crowley.
Thank you, Jan. It's a pleasure to be here with you today and to join all of you at the City Club of Cleveland. I learned a lot about the history of the organization this morning, and it's really a privilege to join you. I've been on the job about 10 months. The president's been in office going on 11 months, and it's really the privilege of a lifetime. You know, I walk through the gates going to work every day. Sometimes I just can't believe how I got here. Obviously, it's always a privilege to work in any White House, but you know, we're really at a time of really unprecedented challenges for our country and really a historic presidency with President Obama. And I just feel really lucky not to be there, but just the opportunity it's presented. So as Jan mentioned, I'm the director of the Office of National AIDS Policy, but I also have a couple other roles. I'm the senior advisor on disability policy, and I also work on a range of health issues within the Domestic Policy Council. And I think that's helpful from an HIV perspective in that it really provides a platform to integrate HIV into everything we're doing. So when we think about HIV and housing issues, we have a housing lead on the Domestic Policy Council. Or when we think about sex education in schools, I have a colleague that leads our education policy. So I think it's a really big opportunity that this administration has chosen to integrate HIV into its broader domestic policies. The first thing I want to tell everybody when I talk about HIV is that this president cares deeply about HIV/AIDS. You know he has a full plate. We have major challenges globally and domestically, but HIV is a top priority. During the presidential campaign, he made a commitment to developing a national HIV/AIDS strategy. So when I was hired, that's really been job number one for me. Before I get to talking about the strategy, though, I just want to tell you a little bit about some of the things we've done to date. You know, sometimes progress can be slow, or it can take a while to sort of see the fruits of what we're trying to do, but I think we're off to a reasonable start. So in April of this year, we worked with the Centers for Disease Control and Prevention to launch what's called the Act Against AIDS campaign. And this is a broad-based, 5-year, $45 million social marketing campaign. But it's about the first social marketing campaign against HIV/AIDS that's been launched in about 15 years. So in some respects, we sort of have lost our ability to do things we used to know how to do. So this campaign won't do everything, but it starts with the first phase of the campaign is called 9.5 minutes, reminding all Americans that every 9.5 minutes someone becomes infected with HIV in this country. And if that's true, that means we all have a stake in this epidemic. But then it'll roll out targeted subcomponents of the campaign focusing on African Americans. We know that HIV disproportionately affects the African American community. It'll focus on gay and bisexual men. We know that gay and bisexual men are 2 to 3% of the U.S. population, but they represent 53% of new infections today. So we're going to roll that out for gay and bisexual men of all races, but then also with subcomponents focusing on gay men of color. We're going to focus on the Latino community. This is just one thing, but it's really sort of a base of many of the broader public education things that we need to do. We've also done some work around promoting HIV testing. And just personally, I was with the National Association of People with AIDS when we launched the National HIV Testing Day campaign. And while I'm HIV negative, the National Association of People with AIDS, it's an organization of and for people living with HIV. And at the time, in the mid-90s, we felt it was important to send a signal from people with HIV that it's important to get tested. And that effort has really grown. And now with the treatments we have, we really think it's critical that everybody know their serostatus. One thing the president did as a candidate is he and Mrs. Obama were tested for HIV when they were in Africa. So when HIV Testing Day came up this year, we cut the video into a little PSA-type YouTube video showing the president getting tested as a senator, but then showing him in the White House, saying, now that I'm president, it's still important for people to know their HIV status. But that's not the only thing. Within the Medicaid and CHIP programs, we've put out guidance telling states that if they want to adopt population-based screening and broadly screen for HIV, they can get federal funding for that. Within the VA system, we put out a rule to routinize HIV screening, to just make it a regular part of medical care. Just this week, we announced that Medicare will expand its ability to cover HIV screening. So these things are all steps that we think are very important. At the end of October, we were very pleased that the president was able to sign into law the reauthorization of the Ryan White program. So if you don't know, that's the main discretionary HIV/AIDS program in this country that provides HIV care and treatment to about 500,000 people living with HIV and AIDS. It fills in gaps left by our private insurance system and our public programs, Medicaid and Medicare, but it's a critical baseline of coverage for people with HIV and AIDS. And so this reauthorized law will ensure that the program continues for 4 years. We're at a time where we're talking about fundamental challenges for our country and budget deficits, but also as we're thinking about health reform,